Congratulations! You are eligible for health insurance benefits and flexible spending account benefits. Now that you've received your enrollment packet, you may enroll in coverage now. Deadline to complete the enrollment process is within 31 days of the effective date listed on your enrollment packet. After the 31-day period, an employee will be considered a late enrollee and coverage will be delayed until the next annual enrollment period. The annual enrollment period is typically held November through December for a January 1st effective date. An employee experiencing a lifestyle change, which could be a birth or adoption of a child, marriage, divorce, or involuntary loss of coverage, may apply for coverage within 31 days of such change. Health insurance helps keep you and your family healthy by providing preventative care and helps protect you from large medical bills in case of an emergency. There are several ways to obtain health coverage. You may be eligible for Medicaid or CHIP based on family income. Go to cms.hhs.gov for more information. Typically, individuals become eligible for Medicare at age 65. Learn more at medicare.gov. If under 26, the law allows you to get coverage through your parents' medical plan. If you have a working spouse, you may be able to get coverage through his or her employer. It's worth checking the coverage and costs and choose the option that makes sense for you and your spouse. Check out healthcare.gov for the marketplace information in your state. Other options, including your employer coverage, are also available. Insurance benefits are available to eligible employees who consistently work 30 or more hours per week. Hours for crew members are tracked over a 12-month measurement period. Crew must average 30 hours of service per week during the 12-month measurement period. If you do not average at least 30 hours of service per week, you will not be eligible for health benefits unless you have a change in employment status that makes you eligible for benefits. All levels of managers, supervisors, office staff, third shift janitors, preventative maintenance, and traveling maintenance who consistently work 30 hours or more per week are eligible immediately following a 30-day waiting period. Therefore, promotion from a part-time crew member to one of the eligible positions listed would make you newly eligible for insurance. However, a promotion from a swing manager to a first assistant or a promotion from a third shift janitor to a preventative maintenance employee will not change your eligibility status. If you have questions about eligibility, please contact Human Resources at 608-781-8080. When you are eligible, enrollment packets are mailed to the home address of all employees. If you elect health insurance through Courtesy Corporation, you may have several questions. Compass Health Pros can help. Calling Compass Health Pros can help you understand insurance benefits and plan options. They can help you find high-rated doctors. They can help you save money on your health care, help provide suggestions to pay less for prescriptions, help resolve billing issues, or schedule appointments. Compass Health Pro is free of charge. You can call 1-800-941-9260 or email McDonald's licensees at compassphs.com to get started. Or text the word COMPASS to 214-220-4608 to get the app. Courtesy Corporation offers benefits through McDonald's licensees health and welfare plan. We offer major medical, dental, vision, life insurance, basic life and supplemental term life, along with long-term and short-term disability. Each coverage can be elected independently of another. Employees don't need to take medical coverage in order to elect any of the other coverages available to them. You may pick and choose whatever benefit options you wish. For example, you may wish to only enroll in dental coverage. The only exception is that you must have basic term life in order to add any supplemental life insurance. The online enrollment is easy. Get started at mymcdbenefits.com. To log in, you must enter your username and password. Your username is your first two letters of your first name, both capitalized, the last four digits of your social security number, and your 6-digit date of birth. Your PIN is your 4-digit year that you were born. After logging in, you will have the opportunity to review your plan options. The cost information has been included in the packet that was mailed to your home. The website will guide you through several screens where you can elect or decline the benefits you wish. Your elections will not be recorded and saved until you confirm. Make sure you write down your confirmation number and keep it for your records. You will need it if you return to make any changes. You can return and make any additional changes to your elections at any time before your enrollment deadline. If you have issues with the online service, call Participant Support Line at 1-866-962-2303. As an employee, you are eligible to enroll in medical insurance through Blue Cross Blue Shield of Illinois. Employees are offered a comprehensive medical plan that also includes prescription drugs. In addition, employees that elect medical insurance are automatically enrolled in the basic life insurance valued at $15,000. The medical plan offers a great foundation of protection for you and your family. Medical coverage is provided by a preferred provider organization. A PPO is a network of doctors and hospitals that offers quality services to you at negotiated rates. You can also see doctors out of network, although at a higher cost to you. It's always important to check if your doctor is in network. To do so, call Blue Cross Blue Shield at 1-800-730-8445 or visit the website at www.bcbsil.com/licensees. If you enroll in the plan, you can also enroll your dependents. Coverage is available to the employee, employee plus spouse, employee plus children, and full family. An eligible dependent would include your spouse, your children, any of your spouse's children, which could be stepchildren, and also legally adopted children. You can cover your adult children up to the age of 26, even if they're not your dependent for income taxes, even if they're not in school, and even if they have a job and have coverage available through their employer, or if they are married. Here is a closer look at the 4 plan options. Each plan covers the same benefits and care, including 100% coverage for in-network preventative and wellness care and coverage for prescription drugs. The difference is mainly in whether you pay less each month in premiums or less when you need care. In general, Health Plan 1, the employee will pay less from their paycheck each month, but more when they need care. In Health Plans 3 and 4, employees pay less when they need medical care, but more out of their paycheck each month. Each year, after you meet your deductible amount, the plan pays a percentage of your eligible medical expenses until the annual out-of-pocket maximum is met. For example, in Health Plans 2, 3, and 4, the coinsurance is often 70%. The coinsurance is 60% in Health Plan 1. After that, the plan pays 100% of the eligible expenses for the remainder of the year. If an employee covers 2 or more dependents, the deductible is met when the aggregate of individual deductible amounts meets the family amount. Including your deductible, the most you'll pay out of pocket for in-network coverage in the calendar year in all 4 medical plans is $6,500 for employee only or single coverage, or $13,000 for all other coverage levels, including family. Health Plan 1 is a high-deductible health plan that is compatible with a health savings account. This summary is also included in your enrollment packet. Doctor on Demand offers live video doctor visits with a low copay for medical plan participants. Online or via mobile phone, you can easily access a physician who can provide an assessment, diagnose, or even write a prescription. Health Plans 2, 3, and 4 cover these visits at just a $10 copay, while Health Plan 1 costs $49 per visit. You'll save money and time and get great care from a board-certified physician through Doctor on Demand. To download the Doctor on Demand app, text the word register to 68398. When you enroll in any of the medical plan options, you are automatically enrolled in the prescription drug card program provided through Express Scripts. The plan offers 2 ways for you to save on prescription drug needs. Walk into any retail pharmacy and have up to a 30-day supply of your prescriptions filled at a discount. When you need a prescription filled for long-term maintenance medications such as oral contraceptives or diabetes or blood pressure drugs, you can get a 90-day supply through the convenience of home delivery. As you can see from the table, you will pay less for generic drugs and also by using the mail order service. You pay $10 for a 30-day supply filled from a retail pharmacy. You pay $25 for a 90-day supply from the mail order pharmacy service. If you choose to have your prescription refilled with a brand name drug when a generic is available, you will be responsible for paying the brand name coinsurance plus the cost difference between the generic and brand name drug. Please note that some drugs may require the mail order pharmacy service. Important note, for prescription drug coverage in Health Plan 1, any prescription drug costs apply to the medical plan's deductible, coinsurance, and out-of-pocket maximum. This means you pay 100% of the cost of any prescription drugs until you meet the medical plan's annual deductible. When you enroll in the health plan, you also receive mental health and chemical dependency benefits and are automatically enrolled in Life Compass, a confidential service meant to help you balance your work and life. It offers counseling and referrals in a variety of areas. Blue Cross Blue Shield of Illinois offers access to a broad network of psychologists, counselors, and therapists. You can contact your Compass Health Pro team for provider recommendations. The Employee Assistance Program is meant to help you balance your work and life. Through EAP, you can get 3 free sessions of counseling and a variety of other valuable services. Please review the slide for a summary of mental health coverage available to those enrolled in Health Plans 2, 3, or 4. For those enrolled in Health Plan 1, mental health and substance use disorder benefits are provided at the same coinsurance percentage as any other office visit or inpatient admission. The plan pays 60% after deductible in-network and 50% out-of-network. Dental insurance is a great way to get free preventative care along with other restorative care benefits for you and your eligible dependents and includes orthodontia for your eligible dependent children up to age 26. The dental plan offered through Delta Dental also provides benefits for oral surgery and other dental cutting procedures. As a plan participant, you have access to many in-network dentists. Nearly 75% of all dental providers are in the Delta Dental PPO or Delta Dental Premier networks. Participants in the dental plan can go to any licensed dentist. Benefits are the same whether or not you use a network or non-network provider. What happens is Delta Dental has negotiated lower fees with dentists in network. Therefore, with lower fees, your out-of-pocket costs should be less. Benefits for the vision plan are provided through iMed. iMed's network includes private doctors as well as many major chains including Lens Crafters, most Pearl Vision locations, Target, and more. Please review the slide for a summary of the vision benefits. When you enroll in medical, you're automatically enrolled in the Basic Term Life Accidental Death and Dismemberment policy. If you choose not to enroll in the medical plan, you can still elect to enroll for basic life and accidental insurance benefits. Basic life insurance pays benefits to a beneficiary in the unfortunate event of your death. Accidental death and dismemberment insurance pays an additional benefit to your beneficiary if you die in an accident. It also pays you should you suffer a severe injury such as a loss of limb or eye. If you participate in basic term life, you can choose to increase your coverage by purchasing supplemental term life benefits as well. You may elect up to 10 times your annual salary. Again, you must be enrolled in basic life to elect supplemental term life. Short-term disability coverage is available to help protect you against loss of income in the event of an extended illness or injury. There are 2 short-term disability options that you can choose from. Short-term disability 500 pays 50% of your basic earnings up to $500 per week. Short-term disability 1000 pays 66 2/3 of your basic earnings up to $1,000 per week. Short-term disability begins paying benefits on the 15th day of sickness or injury. Benefits are payable for 26 weeks or until your disability ends, whichever comes first. Long-term disability coverage pays benefits after 180 days of consecutive disability. The monthly benefit is 60% of your basic monthly income, up to a maximum monthly benefit of $5,000. Benefits generally continue until your normal retirement age. Courtesy Corporation offers eligible employees the opportunity to purchase qualifying health insurance that is intended to be affordable. Please see the rate sheet that was included in your enrollment packet for more specific information about your costs. All rates listed on the rate sheet are monthly. For operations managers, area supervisors, general managers, first assistants, and salaried office staff, Courtesy Corporation pays 50% of the monthly premiums for any medical, dental, and vision. We also pay 50% of the monthly premiums for basic term life and disability. Employees are responsible for 100% of the cost of supplemental term life. Rates for the health plans are based on the enrolled employee's age, and payments are deducted from the employee's bi-weekly payroll. For example, if your monthly cost for insurance is $400, we multiply the cost by 12 months, which is $4,800. We divide that by 26 pay periods per year and then divide it by 2, since Courtesy Corporation pays half the cost. For all second assistant managers, hourly office staff, third shift janitorial, preventative maintenance, and traveling maintenance, Courtesy Corporation also pays 50% of the monthly premiums for all medical, dental, vision, life, and disability coverage. Employees are also responsible for 100% of the cost for supplemental term life. The only exception here is that Courtesy Corporation will use the rate of pay approach to determine the monthly cost of single coverage in Health Plan 1 only. The example is the same for how we determine costs for crew members, associates, and swing managers. For crew members, associate, and swing managers, Courtesy Corporation will use the rate of pay approach to determine affordability. Again, affordability is based on single coverage through Health Plan 1 only. An example of the rate of pay calculation for an employee earning $11 per hour is listed on the slide. The monthly cost for single coverage in Health Plan 1 would be $141 per month. Don't forget, you are paid bi-weekly, so the bi-weekly calculation would be $65.08 per pay period. Crew members, associate, and swing managers can also elect coverage for children, their spouse, and/or family in any of the coverage options. However, you will be responsible for 100% of the cost. Employees also have the option to elect individual coverage in Health Plan 2, 3, or 4. Courtesy Corporation will contribute 20% towards the cost of these benefits. Employees are responsible for 100% of the cost for dental, vision, basic life, supplemental term life, and disability coverage. Courtesy Corporation offers flexible spending options for medical expenses and dependent care, which is daycare expenses. This means that you can set aside tax-free dollars to pay for any medical, dental, and vision expenses, up to $2,650 for 2019, that are not covered by insurance. In addition, daycare paid while you're at work can also be paid, up to $5,000 with tax-free dollars. The use it or lose it policy will allow employees who have not used $500 or less of their current medical flexible spending dollars to carry that amount over to the next plan year. You are not required to be currently enrolled in the medical insurance plan to participate in the flexible spending plans. You may complete the paper enrollment form that was mailed in your packet and return it to Sean Sen at the Onalaska office by your enrollment deadline date. If you have any additional questions about any of the benefits, please contact Sean Sen at 608-781-8080.